County Board of Health. It's 5:32 of the full board present. Item number 1 on the agenda is public comments.
There are no public comments.
Item number 2, approval of the November 19, 2024 regular meeting minutes.
Second.
All in favor?
Aye.
Aye. Minutes approved. Item number 3, legislative session priorities.
Good evening, board. I think Lexi's going to kick us off with this, and then we're going to hand it over to Mark's team at the Commissioner's office.
Thank you. Yes, Lexi Nolan, Director at ACPH. It is December, which means we are about to go into the state legislative session, runs from January to May. You all know that Lane has been working in this space for a number of years, and he's joined this year by Dave LaRocca. They have been coordinating a lot with Calco and the county and other partners to help us identify our public health priorities for the legislative session. And we are excited to let you know that we will be recruiting for a full-time policy position in 2025, given the enormity of the impact of the policy waves that could be coming at us. We're very excited to be able to begin recruiting for that position, which has been a priority for a long time. And we are very happy to have Mark Resin with us this evening. Thank you for joining us, Mark. Over to you.
Great. Thank you very much, Lexi and team. And let me just say that I had really hoped to join you in person. And I was standing on the side of Broadway and Bruce Street just maybe 10 minutes ago, and then saw on, is it Next Ride great? The skip wasn't going to get to my stop until 5:42. So I just turned around, went back to the office, and here I am. But my preference would have been to join you in person. But it's great to be here this evening. And Nick Robles was going to join me, but Nick had an appointment come up, and he's not back home yet from that. So it's just going to be me with you this evening. But I'll spend a few minutes just walking through a little bit here, the commissioner's priorities, and encourage Lane and team to jump in, and happy to, of course, also answer questions and the like. I don't know if we want to, if perhaps the next slide is the PowerPoint. Oh yeah, perfect. Yeah. So we are getting ready for the 2025 state legislative session, which will start on January 8th. And the commissioner's policy team works to advance and support the key public policy and intergovernmental relations goals for the commissioners, much of that being driven by the commissioner's strategic priorities. And we end up investing a lot of time and resources in advocating for county priorities at the state legislature. In large part, that's because counties are statutory subdivisions of the state. Most of our powers and much of our funding comes from the state and is determined by the state legislature. So it's really imperative for us to advance if we're looking to advance and achieve our goals and our priorities, to engage at the state legislature. And my team tries to, in essence, channel the amazing work that's being done across the county organization and bring that to this building, and bring those stories to the legislators and others who make decisions about how we can do our work and how much funding we receive to do our work. So the success of the county's work is really dependent on the expertise and lived experience of our staff, our elected officials, and the constituents that we serve. So opportunities like this to talk with you all and engage in that work are really valuable to us as a team and really helpful to our effort. If we want to go to the next slide, I thought I'd just give you a little bit of a snapshot of what to expect. Of course, 2024, an election year, we've had some turnover in our delegation. So, well, the first slide there, those are the dates of the session. January 8th, Wednesday, will be the first day, and The session will run 120 days through May 6th. I have yet to be part of a session that ended early, so you can always count on it going right to the typically 11:59 on May 6th. There are 100 members of the General Assembly, so you may know that. And over the last number of years, the Democratic Party has had large majorities in both chambers. Currently, there are 23 of the 35 state senators are Democrats, and 43 of the 65 state representatives are Democrats. So large majorities in both chambers. So the Democrats have a lot of ability to drive their agenda, and of course, bring bills to Governor Polis's desk, who's also a Democrat. That's the list of our state delegation members. Representative Judy Amabile is moving over to the Senate, taking the seat of Steve Fenberg, who was term limited. Senator Amabile also was appointed to the Joint Budget Committee, which is really fantastic and helpful. Senator Jaquez Lewis, former Board of Health member, and Janice Marchman make up our other two senators. Janice represents Western Boulder County and all of Western Larimer County, and has been a great partner in her 2 years in the Senate. And then our House members, Kyle Brown, Louisville, Lafayette area, Junie Joseph, who represents Boulder, Karen McCormick up in Longmont. Leslie Smith is new to the delegation, former State Board of Ed member or BVSD board member, former CU regent, and she's taking over Judy Amabile's seat. So her seat is very large geographically, represent Boulder County, but also Clear Creek, Gilpin, Grand County, Jackson County. So she's got a big district. And then Representative Dan Woog is also newish to our delegation. He served in the General Assembly from 21 and 22, lost the seat to Jennifer Parenti for 23, 24, and then Rep. Parenti decided not to run for re-election, and Dan Woog won the seat back in an open race. So he's the 8th member of our delegation. Perhaps another thing to mention is that we've lost Steve Fenberg as not only a member of our delegation, but as the Senate president, which was very valuable to have a member in a place of leadership like that. And now Senator James Coleman from Denver will be the new Senate president, and Rep. Julie McCluskey, who has been the Speaker of the House for the last 2 years. She's from Summit County, was reelected and will be Speaker for the next 2 years. And then maybe the last piece of context is that this is two pieces. One, Governor Polis is in the last 2 years of his 8 years, so that's an interesting little dynamic, perhaps may influence things happening in the Capitol. And then, as you've all likely heard, the state budget gap for fiscal year 2025, 2026 is now over $1 billion and continuing to grow. So budget austerity is going to be a key theme moving throughout the General Assembly. And I'll pick things up here a little bit. We can move to the next slide. I won't dwell on this, except that we did a little bit of work to evaluate the 2024 session right afterwards, and just really wanted to note that 705 bills were introduced in the 2024 session. We ended up lobbying and taking positions and engaging with about 150 of those bills over the course of the 120 days. So it's a busy, it's a aggressive agenda, one that we're very active down at the Capitol, and really trying to drive lots of outcomes that are positive for the county. You can see some of the places we focused our time in 2024, in particular involving our frontline staff and community partners, and doing our best to integrate racial equity into legislative review and advocacy were two highlights. We can move to the next slide. This just gives you a little bit of high-level overview of our process for engaging with the legislative, with the General Assembly. In short, you lay your foundation for success in the session in what we call the interim, when the delegate or when the General Assembly isn't actually meeting. That's when the real work gets done to develop bills and develop the coalition support you need to get them passed. So we review the past session's successes and challenges. We gather new proposals from the commissioners, from our staff, from key stakeholders, from our community, and then we develop legislative principles and budget priorities out of all of that work. And that the principles and the legislative and budget priorities really guide our work throughout the session. Very similar to the process that BCPH staff uses. So next slide, just wanted to touch on our principles quickly. We have 3 legislative principles that guide our work: racial equity, climate action, and environmental justice, and financial and organizational stewardship. So we really try to focus our review and analysis of all legislation through the lens of those 3 principles, and really trying to center racial equity at the top of the list. And as we work through the legislation and ultimately take positions on bills. So those are our key legislative principles that like I said, we utilize and are trying to utilize in all of our work. And then next slide, you'll see some of the these are the priorities, sorry about the tiny type, but these are the priorities that the commissioners have identified for the 2025 session. And any number of these, I think, are really directly intersect with the work of Boulder County Public Health and are likely to be priorities for BCPH as well. In fact, I know they are air quality and ozone reduction, gun violence prevention, youth substance use disorder work. Love to see retail food establishment fees on that list. Lane and I have attended not recently, but a number of years ago, we attended lots of meetings about retail food establishment fees, and we're still engaging in that space. A couple more to mention here that in the legislative priorities that we're really keen on. The second one from the bottom there, county revenue diversification. This is all coming out of the work over the last several years that the General Assembly has been done, both under its own intentions and also because it's felt like it's had to negotiate away property tax revenue to keep really bad ballot measures off the statewide ballot. But property taxes have been reduced 3 separate times now by the General Assembly over the last couple of years, which really takes a hit, is a big hit for property tax funded entities like county governments. About 25% of all the property taxes collected in the state go to fund county government. And so we're dealing with challenges because our revenue stream has been nicked away at, while of course expenses and costs continue to go up. So we're going to be focused on a number of efforts to try to diversify the revenue streams of county governments, authority to charge new kinds of taxes, different kinds of taxes. Of course, those would have to be approved by the voters, but at least we're hoping to grow our toolkit and then have options to bring more strategies to our voters to see if they'd take that up. And then on the budget side, I mentioned the $1 billion and growing budget gap. So there are a number of items in this list that are priorities for the governor, the Stationary Sources Control Fund on the air pollution side, the Clean Water and Drinking Water Cash Fund, et cetera. So we're really confident that we can get a number of those types of items over the finish line and then continue to really work hard on ensuring access to safety net benefits and all of the stuff related to human services and ensuring that Coloradans have access to the benefits that they need and that they deserve. And local public health agency funding, another priority that we'll be working on likely through supporting the work of CalFO. But again, a number of these issues certainly intersect with priorities from the public health community. Next slide is just to show you that we work with a really diverse group of partners, and you all know well that coalition building is the name of the game. Down at the Capitol, you need to have broad support for your ideas and for your legislation and for your budget asks, et cetera. And this is just a list of some of the entities that we end up collaborating with in any given legislative session. And we do have a keen focus on some of the the more the professional associations like CALFO, like the Human Services Directors Association, like our statewide county associations, CCI, Counties and Commissioners acting together, CC4CA working in the climate space. So good examples on this slide of the entities that we end up collaborating with in any given legislative session, and are working with them to achieve mutually shared priorities and goals. And the last slide is just the team, Nick, Cindy, myself, and Summer. And please reach out to us anytime if you have questions about the work that we do to support the commissioners and the county organization and our collaboration with public health staff. We'll look forward to supporting one another as bills start coming forward and we start planning for committee hearings and developing talking points and all the fun things that go along with the work of advocating for county priorities down at the Capitol. So happy to hand the floor back to Lane, and certainly happy to stay on to answer any questions you may have.
Thank you very much, Mark. Very much appreciate you and your team. We're very lucky to have them, especially since Summer, Nick, and Cindy are former public health staff. So they're all very
Stop
well
pushing our
versed in
people,
public
Mark.
I wasn't
All
going to
for
mention
good-
that,
all
but
for good. If you would do the next slide, please. And my name is Lane Drager, for those that I may not have met. I work in environmental health, but one of our sort of other duties as assigned for Dave and I is working to support organizing our policy efforts. So just to kind of run through what we've been doing for several years, and no real significant plans for change for this next coming session. But we organize, and thanks to Mark's team also, we use some of their bill tracking software to help follow the different public health bills that we're looking at and interested in. We also collaborate very closely with CALFO, the Colorado Association of Local Public Health Officials. They have a policy committee and a contract lobbyist. We also work very closely with the Colorado Public Health Association, who also has a contract lobbyist. So very much aligned in a lot of our priorities, and then get a lot of leverage for efforts from their lobbying teams. Internally, we have a group that we meet in the off session. We've been meeting monthly just to kind of stay connected, but we are planning to increase that frequency back to twice a month, as we've done in past years, and let folks attend, at their convenience. And then we're sending updates kind of intermittently. But the main effort is to really help support folks that are engaging in policy for their various programs. So really, Dave and I and Marianne are kind of trying to organize the efforts, make sure folks have as much information that we have at our disposal, and then kind of support them when they're looking to potentially take positions on bills. So really, we help get that information into Lexi's hand. Lexi kind of weighs in to make that final decision if it is fitting with our priorities, and we do want to engage in action around any policy. And then we can also support with some review. And then we also connect very closely with Mark's team. So if there are bills we're planning to take positions on, we're working with them. They're often able to engage with various stakeholders as well, and assisting in some of that policy advocacy. Next slide, please. Just to kind of jump into a couple of priorities, Mark touched, I think, on both of the ones that I'm going to talk about, but in the governor's budget, there is a proposal to reduce local public health funding by just about $1 million. And for us, while it isn't the most significant part of our funding, in the first part of next year, since the state fiscal budget runs July 1st through June 30th of the following year, we're anticipating it would be about $20,000, and then kind of the full year after that is about $40,000. So it isn't, again, the biggest impact to our budget, but I think it comes on the heels of us finally seeing a pretty decent increase in the previous budget for local public health funding. And we're also concerned about, where things are going at the federal level. And so a lot of the pass-through dollars potentially might be impacted in a lot of areas, environmental specifically, and then CDC and others too. So that CalFO is going to be actively working on this. Mark talked about Senator Mobley being appointed to the JBC, the Joint Budget Committee. So that's one of our Boulder delegation. So we're hopeful that potentially that could get changed. In the last session, the governor had proposed a lower local public health budget than what was finally approved. So we were very happy to see the JBC did kind of award more money based on some of the lobbying efforts. So we're hopeful to see that doesn't again go in that other direction. Next slide, please.
One additional note, Senator Kirkmeyer, who is a leading voice on the JBC, was an advocate for the public health funds, and she said that this is her top priority, is to preserve those funds this year.
Yeah, thanks, Lexi. Senator Kirkmeyer has been a good champion for us, and even on this next one, so I'll maybe add some of that note in there. So Mark talked about retail food fees. This has been a battle for a long time for us because our fees are set in statute. So it takes running legislation to make any changes there. The state CDPHE runs a process, a triennial review every 3 years to look at programs, the retail food program. Fees are a significant component of that triennial review. So this year, they've been running that process. They had a number of proposals. I'm not going to show you the various proposals they were talking about. I'm going to show you the one that it sounds like they've come to agreement on, which was not one of the ones that they discussed throughout their whole process. So they came up with a fourth proposal, and this is it, where they're looking at phasing in increases to the retail food fees that would start in 2026 with a 25% increase on the current fees. And then these fees are compounding. So year 2 would be a 20% on top of that increase, and then another 20% in the third year, which would bring them back during that process to the triennial review. So that it's kind of, I think, a tactic of industry to do these phases, and then they may or may not discuss the fees again in 2027 during that triennial review, because they say we're already working and we already have these fees that are already proposed. So I think that has been a strategy that has been effective for them to kick the fees down the road a little bit longer. Just to give you an understanding of our current funding, and we are fairly significantly understaffed in the retail food program. So of the current team we have, we're funded about 45% by fees, and then 37% by county funding and 11% by grants. We also get some minor funding from the state, and then we get a little bit of money from some of the training work we do, and occasionally some penalties for facility operators. Senator Kirkmeyer has also stated that she is very supportive of supporting these fees. One of the nuances in the triennial review, the state gets $43 of every license fee we collect, and they are looking in year 2 of that phase in to do a 50% increase on their portion, so up to $66. So that is something that Senator Kirkmeyer indicated she is not supportive of. And that's going to be a nuance that will be challenging for us. We want to see these fees go through. Obviously, the additional portion to the state cuts into our ability to further support our program with fees, but we don't want to see this fail because of some of that. So those are some nuances that will be challenging to navigate. But this is the proposal we are expecting to come forward. There was discussions around trying to remove this from statute completely, which has always been something we support because it's always a battle to get these fees increased, but that's something industry does not want to see. So
Lane, when the increases in fees go in, if the proposal that is up here goes forward, how will that impact that fund? How much of our program will be funded by fees then?
This will be, by the end of year 3, would be an 80% increase in our current fees that we get. So it would be significant. We will be a lot more fee driven. And that's been, a challenge when we've looked at our budgets. We've reduced county funding quite a bit in this program. In fact, it's it's dropped quite a bit just this 2024 budget year. So it will help us. We're hoping to still see potentially some reinstatement of that funding so that we don't continue to have that shortfall in FTE. But I've been kind of waiting to see an actual bill draft before I start calculating things. But that 80% in overall fees, and then depending on how much the state takes, those are some of the nuances to figure out to see. But it will still be a nice bolster to our program. Next slide, please. So one of the big things that we do is meet with the board to get approval of legislative agenda. So big thanks to Eliana, who was a PHAP working for us that ended this last year. She did a lot of work to put together the initial draft of our legislative agenda. And then big thanks to Dave, who really took it and tried to marry it with all of our other strategic priorities so that it's a document that you can see not only what our policy efforts are, but also, again, how it aligns with a lot of our other priorities. So that's what we're here to ask from you is approval of that policy agenda, which should have been in your packet. We've got a lot of overlap, I think, with the commissioner's policy agenda, but we've really pulled out the public health specific components. Next slide, I think, is Lexi.
Right. So we are continuing to develop our infrastructure, but expect that the incoming policy person will help accelerate this process. You all know that we have, over the last year, Lane and Dave worked with the county, and I think particularly with Summer, to tap into some of the real-time updates of what was happening with specific bills. And so I believe that we're planning to utilize that platform again this year. Is that correct, Lane?
Yeah.
Yeah. And so we'll also be incorporating some federal tracking and planning into our policy work. You all know that I'm going to be working on building relationships with our state delegation. Some work has already begun. Really continuing to develop opportunities to identify local policy opportunities and community partner roles. We have found that bringing our community partners in to testify and helping them with testimony is extremely effective, especially when there's lived experience behind it. Looking at the mapping with our strategic priorities. And then, maybe this should have been first, hiring the position fairly early in the year. Is there anything else that you all would like to add to that?
Just in that component that you mentioned about really engaging folks, Dave did a great job working with CalFO and their policy director, and we've done some initial trainings with staff, as well as Mark's team has done some trainings. And we're looking to further augment that, doing some more work on building skill sets for specifically testimony. So we want to continue to augment our staff and our partners' skill sets so that we are more robust when we're engaging in policy work.
We have 5 minutes left on this topic.
I just want to take a moment, Mark, to hear from you, or any of you, actually, because I think it's helpful in the past when you've told us, what are you anticipating are sort of the big policy themes or specific policies that you think the governor is going to be championing in the session ahead? Whether or not they're directly related to public health, but.
Anything that doesn't cost money. I think the governor will, in fact, we know the focus of the last 2 sessions on housing and land use and really trying to build up housing supply in particular will continue. There are a number of bills that we're already aware of in the housing space that will continue to follow down the same track as like the accessory dwelling unit bill or some of the other legislation that the General Assembly passed that will loosen up current zoning restrictions and the like, and allow for increased housing opportunities. We'll undoubtedly continue to see efforts around economic development and sort of the business side of things, which is a high priority for the governor and has been from the get-go, given his background and how he came to being a politician. And then maybe the other thing, probably most importantly, and we've got it on our agenda, we're not publicizing it too much, but engaging in a number of ways to prepare for new federal administration and changes we may see at either the state level or the local level that might be driven by a changing administration at the federal level. In particular, steps that we can take to support our immigrant community and other communities that are potentially going to be under the microscope. You'll all remember there were a couple of items on the statewide ballot in November that the word I used was, they were designed to inoculate the state against any changes that might happen at the federal level, the gay marriage amendment and abortion rights. You'll likely see more legislation along similar lines to, in essence, protect the values of Coloradans from any reach from the federal government, especially any potential actions the federal government might take because Colorado is such a blue state. So that'll be another theme that the governor and the General Assembly will be working closely on, I'm certain. So we'll be prepared to engage with those in those areas that intersect with county goals and priorities.
Great, thank you.
Next slide, I think. So again, I think we're very excited to bring this policy agenda to you, looking for the board's support. Also, if there's any specific topic areas that individual board members, I think Jordan has worked a little bit with the board already to identify things. That helps us navigate getting those kind of things in your hands, especially if you're interested in providing any kind of testimony, whether that's virtual, written, or in person. Just because the session does move so quickly, things get scheduled for hearings with oftentimes not a ton of advance notice. We're happy to try to fine tune and make sure specific topic areas get into your hands quicker. Otherwise, we typically send out something about every week or two, summaries of some of the things that are going on just to keep you aware of what's happening, and then certainly can come back to board meetings during the session if that's helpful.
Really helpful. Anything with harm reduction or the opiate settlements, I'd be interested to hear more about.
Yeah, and I think in the past, I know I really appreciate the biweekly updates on here's what we're seeing come through. So that's been really helpful for us just have an opportunity to follow. And I think last year I did testify. I think Nick reached out. I would continue to be open to that if you think it's helpful to have someone from the Board of Health testify, and I think that others might be as well. So if you have specific requests as the session is moving forward.
Yeah, and if I would just add to, if there's letters that we can help pen or at least sign as the Board of Health, I think we'd all support that. And we've talked about coming in and helping more as a unified board on some of these issues. So would be eager to, we'll need some guidance from you, but eager to help with those things as needed.
Yeah, well, again, very appreciated. I don't take it for granted. I know that I have peers across the state and across the country who don't have the similar support of a Board of Health. So I never take it for granted and very much appreciate it.
We also appreciate you.
That's right.
The team.
Yeah. Yeah.
It goes both ways, Lane.
Yeah, thanks.
Okay, so we need board approval of the policy agenda. There are no other questions about the specific agenda.
I second.
All in favor? Aye. Okay, well, go forward and keep up the good work. Lane, I also read that you are retiring from BCPH early in 25, so we will really miss you.
Yeah, I'll miss all of you too. So thank you. It's been a great ride.
Thanks for your leadership. Thanks also, Mark, to you and your
Yeah,
team.
thank you. Thanks for having me today. Appreciate it.
Okay, item number 4, agency key performance indicators and dashboards.
Thank you, and good evening, everyone. Nice to see you all again. It's been a month. My name is Elise Wall. I use she, her pronouns, and I'm Health Planning and Evaluation Program Manager here at BCPH. I apologize in advance. I do need to leave at 6:20, so I'm going to try and get through my presentation as quickly as possible. Then I may take it back to our lovely senior leadership team to answer questions, or obviously, please feel free to, share any questions with Jordan and our team's happy to answer them later on. But if you want to go ahead. I guess I should preface by saying, what I'm here to chat with you all about today is to provide a high-level overview of some of the work that our HPE team has been involved in the last several months to support identification of key performance indicators for BCPH programs. As a little bit of background of what this process has looked like, Lexi approached the HPE team back in July to request us to devise a process for identifying KPIs or key performance indicators for BCPH programs. And in August, our team came back to the management team, presented on our proposed process and a template that we'd be using with BCPH programs. And then once that was approved, we moved forward with meeting with divisional leadership teams to provide them the context. What are we asking you to pull together? Define some of those terms, clarify what we're looking for and why. And that happened in August and September. Our program managers worked to finalize those KPI templates for their programs. And in September, we asked our management team to review and approve the KPI templates for programs housed within their respective divisions. Once that was all completed, our HB team in October set about compiling all of that information into a master document where we could see all of our divisions, our programs, the KPIs, and other key performance or key programmatic information that we had tasked them with collecting. You want to skip ahead? So I'll describe this first. So in terms of what was in these KPI templates and what programs were tasked with providing basic programmatic information. So their name, program name, purpose statements, the division, program manager. We did ask programs to indicate if their programs aligned with both BCPH strategic priorities as well as Board of County Commissioner strategic priorities. So they did provide us with that information. And then we did ask each program to identify approximately 3 key performance indicators, trying to really focus in on what were those key metrics that their program looks to drive decision-making. We weren't hard and fast on that, but that was the general guidance we provided. And along with each of those key performance indicators, we asked them to provide what the most recent and currently available data was for each of those indicators, to provide the 2024 target if it had been established. Let us know the frequency with which that data is collected. Is this collected annually, quarterly, so on and so forth? Whether they were required by either their grant or some statutory obligation to track and monitor the indicators provided. And then last but not least, share any notes that they had. So I did want to preface this presentation by saying, at this time, we are not sharing this master document with you all as it's not quite ready to be shared. And also we are working very closely with our administration and finance colleagues, as well as our communications team to ensure the quality of the metrics that we've received and also package it up in the appropriate manner to share with you all that's most useful to drive decision-making and most useful for various audiences. And I'll share a little bit more about that audiences piece on the very last slide. I think you can go ahead and skip to the next one, Dahlia. Thank you. So what we did want to provide today was just a very high level overview of looking at all of the information that was provided by programs. What do we have ahead of us? And again, kind of wrap up today with sharing what our next steps are. So overall, we had 61 programs across all 6 branches or divisions of our agency participate in this exercise. You'll see a breakdown of where these programs are housed. 11% been in A&F, 7% in CDM. Environmental health had a number of programs participating, and then, yeah, I won't read off every single number to you there, but you can see the general breakdown. If you want to skip to the next one, Dahlia. In terms of strategic priority alignment, we did, of the programs that did indicate that there was alignment between their program and the strategic plan. As you'll see, the most frequently cited strategic priority that programs aligned with was health and racial equity, followed closely by community engagement, and third place, mental and behavioral health. We're going to skip to the next one, Dahlia. In terms of, not yet. Oh, your computer is having it. Oh, there it goes. Oh, see. Hopefully we get to this last. In terms of program alignment with the Board of County Commissioners strategic priorities, most programs, again, that indicated there was some form of alignment, indicated that they connected with the racial equity and inclusive community engagement strategic priority, followed by mental behavioral health, and then finally followed by community environment and climate action. We're doing okay?
It's just having a moment. Check that one. Let's see if I can quickly share.
While they're pulling that together, the next slide I was going to share with you all was just kind of a very high level overview of, in looking at the indicators that were captured overall. We had 182 indicators captured across all of those programs. And then we kind of categorized them and generally broke them down on whether they're more process focused versus more outcome focused. We had, oh, perfect, thank you. You'll see that 2/3 of the indicators at this time are mostly process focused. And by that, we mean really more focused on the how the work was completed piece. And then the final third is mostly focused on outcome focused measures. So the what were they doing? What were the results that they saw in the populations that they are serving? So that's just a very quick and dirty evaluation as we were reviewing the indicators to categorize them. Again, are they more process, more outcome focused? I'm going to switch to the next one. Again, I mentioned that we asked programs to indicate if current data was available and if they had had any 2024 targets established for those metrics. We have 2/3 roughly, a little less than 2/3 of those indicators did have current data available. A third did not quite have current data available for this year. In terms of whether or not 2024 targets had been established, we had over 3/4 of our indicators did have 2024 targets established. So what they were hoping to achieve by the end of this year. I'm going to skip to the next one. In terms of frequency, over half of the indicators that folks included are, they reported that the data was captured on an annual basis. The next largest category would be data collected monthly. And then this other category, this included a variety of things. This is everything from folks have maintained systems where the data is available on demand so they can capture it today if they wanted to, all the way to some programs that were including key performance indicators that they acknowledge they aren't currently capturing data on this, but moving forward, they would like to be tracking and monitoring data around these indicators. Next one, Dahlia. I'm sorry, I'm making you whiz through these. Oh, thank you. Sorry, it did change for a second. I was like, how does it change? I think this is our last one. This is around, again, we did ask programs to indicate if the KPIs that they provided were required of them to monitor and track and evaluate. As you'll see, this is the general breakdown of whether it was required at the federal level, state level, county level. It was a grant reporting requirement, and then as you'll see, nearly 1/4 of our KPIs for programs are not formally required per se. Go to the next one. So again, this was a great exercise for our team and the agency, I would say, to understand the general landscape of data collection, metrics for our programs. And we are also very excited to expand upon this effort in 2025. And so we've identified some opportunities for improvement as we look ahead to continuing this work. First and foremost, this year we set about capturing this information in an expedited manner, I guess I would say. And looking ahead to 2025, our HB team would really look forward to facilitating a more formal process with programs to ensure kind of the quality of the metrics that are being identified, the quality of the data, increasing standardization in terms of how programs are responding to certain questions within the template. We also would love to dive a little bit more next year into working with programs to understand where, how, and who's responsible for capturing that data. So understanding the systems in the background of where these data are captured, where we can access it. Are there ways of streamlining that so that generating reports is a lot more easy, both at the program level and at our team and agency level. And last but not least, more formal guidance on how we are defining programs and strategic priority alignment. We gave general guidance to programs this year, and in many cases asked them to defer to their senior leadership, to their branch manager or their division director. So I think having much more clear and explicit definitions for these terms will support programs and just ensure greater consistency as we're capturing that information. Last slide. In terms of next steps, so I kind of alluded to this just a second ago, but again, this serves as a great starting point for some of the important work that our HP program is looking forward to in 2025. So expanding programmatic performance management, and then identifying those existing opportunities for alignment between programmatic work and our current strategic plan. So as we work to build out more quantitative measures for our strategic plan, working kind of from both ends to support programs and how they're measuring alignment with the strategic plan or measuring their work contributing to the strategic plan. And then the other area that we're very excited to dive into next year is working more closely with our A&F colleagues and our communications colleagues to build out various dashboards for information such as this, in addition to some of the other dashboards we've mentioned in previous meetings with regards to the strategic plan, population health data dashboards. But specifically with regards to programmatic performance, we're looking forward to building out dashboards specific to individual programs, dashboard specifically for our leadership team to drive decision-making, dashboard for the Board of Health to understand kind of current state of operations for our agency, and then also for external audiences. So the general public, potentially the county commissioners, other folks who might be interested in understanding what we do and how we're doing it. Want to go to the last slide? That was a very, very quick, I apologize, but a very quick and dirty overview of where we are at with this process. And I have 1 minute to spare. So with that, I guess we can answer if there's any urgent or burning questions. Otherwise, if there are, I'm happy to defer to Lexi and Kelly. Respond to them. Be there.
Have some questions, but they're not urgent, so I can pull them and ask them here or ask them later or however you guys want to handle it.
Sure. I defer to you all if you're happy to tackle them. Otherwise, I'm happy to have them sent over to our team and we can respond.
Sure. Let's explore and we'll answer what we can and we'll get back to you on what we.
I think my main question is, so you're getting reports in from teams. How are you guys thinking about whether those are the right metrics and what the priority metrics are for each program and how you're thinking about them up based on programmatic priorities? Sort of outside of the strategic plan, but more back to the conversation we're having about budget prioritization overall.
You want to take a stab at that?
I'm sure I'll slash and burn. So I think, first of all, this was a first step, right? In fact, this was way more accelerated than we originally planned. And Lexi asked us, and she had some good reasons to do that. We pulled some of these spaces together. The reality is we were going to be working on exactly those spaces because you have to approach this in a strategic manner, right? And seeing how we're going to collect that information and bring that and how do we best use it. And then when we start connecting with Armando in this space, how does A&F, like you said, play into, how do the budgets play into this space? And what sort of dashboards do we pull out? What does that look like for the audiences? So there are many facets to, I think, what needs to happen. And it's also a cultural shift because we've never done this type of work as an agency at an agency level. So we want to try to get it right or as close to right and be flexible as we can. So I think those are great questions. I don't think the answers exist yet, but I think some of the questions, I'll give you an example. When we're pulling together a dashboard, for example, of all the different strategic priorities, I think one of the questions becomes strategically, what's the best approach to do that work? Not just what's in it, but that's really important, but what's sort of the timeline or what's sort of the priorities within that space. And as, for example, mental and behavioral health should be a priority for us pulling together a dashboard that is community facing or, facing to the commissioners and to y'all and things like that because of the mental behavioral health ballot tax coming up. So there's thought processes. So we're meeting with Armando's team in the beginning of January to start pulling some of these spaces together. And so it's not, I don't think this is something that's going to be, completed by the end of January, right? I think, but there'll be decisions made on what we need to prioritize and move more quickly. So we've been looking at the last point, as I said, it was a little bit of slash and burn. The last point is we've been looking at other dashboards because from other communities, like we were looking at one from Santa Cruz County in California. Because there's a lot of stuff out there that we can sort of copy and it works well, right? This is, we don't want to reinvent the wheel and there's tons of wheels floating out there, right? And so the long answer is I can't give you exactly the step-by-step, but the question you asked is one of the questions that we have to tackle coming into 2025. And so we're planning for that process now in December and jumping in with the ANF team in particular, coming in early January, like within the first couple of weeks. Yeah.
And Kelly, I think that makes a ton of sense. That's how I was thinking about it, which is let's just start with where you think the key areas are that you want to measure first. And focus there, right? And really make sure that the metrics are identified, even if they're not available, right? You've got the right set of metrics identified and getting input from experts on that to say what, in the behavioral and mental health space, what are the right metrics that we need to be actually measuring? And then matching them up against what the staff has provided to say, all right, where are we gapped? But you can't do that, I agree, across every single aspect of every single program. But I think prioritizing would be really helpful. And that's a similar conversation we're having with Lexi, right? About, programmatically, we need to prioritize. We need to be clear on our priorities as an organization in 25. And so I think that goes hand in glove with that overarching theme. So I think it's really helpful. And the strategic plan may or may not provide that guidance, right? Like you may say there's more core operational pieces that need to be captured first, and then you move into those more innovative places or whatever that looks like. So, okay, that's super helpful. Thank you.
Yeah, no. And if you have any other ideas, you should talk with us.
Yeah.
All y'all are your input is welcome in this space. Because like I said, this is new for the agency, right? This is not something that we really worked on or had in the past. And so this is an opportunity for us to create, something that works.
Yeah, it's awesome. And I know you guys are taking it one step at a time, so I appreciate that.
My only question is about, thinking about how we can streamline that dashboard menu, for instance, so that we don't have maybe 6 different dashboards, but, is there a comprehensive dashboard that, just because I think that when you talk about all the different audiences, there's definitely some shared alignment, I think, in what all those audiences need to see or want to see. So, just don't like the idea of establishing and then maintaining so many different dashboards for so many different, right? I just think that we should be clear on what our priorities are, and that should feed into the dashboards, and then that can be shared by multiple audiences.
Yeah, I just wanted to, that's a yes. So we're definitely looking at that. I mean, we're hiring the MEL specialist to jump into the space to help manage that. I think one of the key things is what data and information do we need internally, and what do we want to share externally, right? And so I think looking at those spaces or what's helpful for us for the internal decision making and what are we projecting out. And that's when we looked at the KPIs, we were looking at, God, would we want to report on that to the community? Probably not on some of those, right? And so it's that sort of exercise as well, I think, as part of this process. But yeah, the less the better. You don't want to do 6.
Yeah, I mean, and I also think there's a space for, like, how are we increasing our transparency with the community? So like if it's something we're looking at, we want to be able to share that externally too. So.
Yeah, and I think that's why it goes back to those priorities, right? It's really being clear about what actual agency priorities are, the metrics that line up against that, how you sort of indicate those. And I think there's an executive level view and then there's a staff level view. And those can be, but in my mind, you don't want those disconnected. Everything should connect together. Otherwise, you're going to have, to Morgan's point, like 5 different dashboards and they won't be good management tools ultimately. So yeah.
Thank you for continuing to move us forward in the this direction.
It's a slow slosh through.
I think it's going to be exciting because it really will provide a lot of empirical information. You know, when we can match metrics up with what's going on with population health measures, when we can match metrics up with what's in the evidence base about this is an impactful intervention, and then use that for thinking about, you know, do we have the talent that we need to accomplish this? Do we have, what does this tell us about budgeting? So I think it'll be quite useful.
And those data points come in so handy when you're talking about, you know, your policy agenda, when you're talking about your budget. You know, these are things that are asked, right? They have been asked, and we haven't been able to really produce these things in a meaningful way. So I think it just arms us better to have those external conversations, which is great.
Yeah, I'm gonna make one last comment, if that's okay. The cultural shift, I think, as an agency is going to be rough a little bit in the beginning, but once I feel that staff see that sort of that all the good stuff we're all talking about, I think that they're going to be going like, oh yeah, this really makes sense to do this, right? And because we have great staff, and it's just that shift in the way we've operated, so I think it'll be good.
Okay, our item number 5 is approval of the budget resolution here.
Good evening, Board of Health. Today we bring forward the 25 budget resolution presentation. It's been a collaboration effort between stakeholders, the team, and the hard work from leadership. Ultimately, today we're going to walk through the proposed 25 budget resolution. As you can see with this resolution that we bring forward to you, has really 3 core themes: alignment with our values of equity, sustainability, and fiscal responsibility. Our strategic plan also plays a part in making sure that, you know, we provide public health outcomes, and then the commitment to transparency, and that we ensure that we deliver meaningful impact to our community. As you can see in the slides to come, we've really done our fiscal duty to make sure that we looked at historical data, budgeted data, and really provided a really lean budget this year. Next. On this slide, I really just wanted to provide you some information in regards to the final budget that came from the county commissioners. We'll continue working with them closely and really just obviously using our software systems, our financial systems, and making sure that we're tracking and collaborating with them to provide good reporting for our staff, and ultimately for the public also. So as you can see, the original requests and ultimately their final decisions, primarily the biggest one that you see is the sustainable tax, and it's not new. We are very transparent providing this information to the board, but that's where we did see some of the cut or some of the reduction. But otherwise, I think we're pretty well in a good position as far as what the commissioners provided us this year. Any questions on that? So the important part, we'll be seeing a little bit more of the source and use, and so I wanted to bring this format as much as I can so you can get familiar with it. So we'll start with just a quick overview of the proposed source and use. Our proposed source and use for the 25 budget is a total of $22,301,655. That is our sources, while the proposed 25 uses amount to $24,427,935. To balance the budget, we plan to utilize $2.1 million from the public health fund balance. Additionally, the proposed 25 budget reflects a 5% reduction, and it will continue to implement priority-based budgeting strategies for 2026. Questions on that? Hope you can see it.
Is your sources number incorrect? I think you have the same number
But
The
it's
fund
before adding the fund balance, I think is what he said. It's
Yeah,
okay, got it.
because it's
just
not new revenue.
Yeah.
I want to state it as
Got
a
it.
transfer.
Okay.
Thank you.
Yeah, and I think you, I just want to say that we went over this during the
Yeah.
budget study session. That was really helpful, setting the context, and we had opportunity to go into more detail. So yes, this all looks familiar from that budget study session that we just had.
And we'll continue using this format, just sourcing use pretty basic and standard. And hopefully we'll get to where we're minimizing the fund balance and ultimately using, new revenues coming in to balance our budget. That's the goal. And so really quick, as we close, I want to focus on the long-term public health sustainability plan, which outlines key strategies and next steps to ensure our financial health and ability to serve the community effectively over the coming years. First, we will prioritize core and equity-focused services and programs, ensuring that resources are dedicated toward initiatives that align with our mission, value, and strategic plan. Next, we aim to enhance cost efficiencies by identifying opportunities and streamline operations, reduce waste, and maximize the value of every dollar spent. What I do want to talk a little bit more is on the next step. So really what we want to focus on next steps is starting 25 early. We do want to bring a retreat, but before we start the retreat, we're actually going to be meeting with the director's team and really start planning out the priority-based budgeting. And I just want to be very transparent when it comes to priority-based budgeting, it's not an easy process. And so it is a drawn-out process, but I think we can start building it early. So by the time we start building 26, we can start either phasing a phase approach or really looking at the priorities to bring into the board or the retreat to have some kind of direction. It's a big undertaking. So I just want to prepare y'all. I think I'll probably put something in the months to come to kind of give you an orientation on priority-based budgeting. I think that would be good. So we all establish kind of the terms and kind of the final outcome what we're trying to accomplish. That would probably be the biggest undertaking this year. And then ultimately really just coming out with a 3 to 5 year plan that we can try to accomplish within the next 3 to 5 years. And otherwise, just the reporting, I think I talked about being a little bit more transparent. So we got the reporting also not just for staff and the programs, but also obviously for the board. We're also meeting more periodically with the county to make sure that what is in our system is also in line with what they're reporting. We've been working, or the team's been working hard as of hopefully by tomorrow, if this gets approved. That will at least be balanced starting off the January year. Any questions? Really short. I think we gave a lot of information the last study session, but I'm open to any feedback or any questions that you may have.
I do want to thank the commissioners for their support. It's great.
Yeah.
And that's important, and appreciate the prep that has gone into getting us to where we are, and looking forward to having more time to work through our budget.
Absolutely.
As well.
Any other questions?
I agree. I appreciate the high level overview.
Thank you.
Okay, so at this point, we would ask for approval of the 2025 budget resolution.
Right, which was part of our packet. See it? I'm looking for a motion.
Okay, sorry. Make a motion to approve the 2025 budget.
I second.
Great, thank you. It's resolution 2024-03. All in favor?
Aye.
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 Great. Great. Thank you so much, Armando, again, for your good work and all the work of the team. Thank you. Thank you.
Sarah and Jerry and
Yeah.
all of the program managers, Desiree and program managers, division directors. There were a lot of folks that made this happen pretty quickly. So
But yeah, this feels good. This feels very good to be in a position where we feel very confident about the budget also.
Oh, and I just wanted to bring up, we'll pass the budget. Do you have the budget? So we are working on a budget. We'll have a full published budget We'll have full copies in January, but I just wanted to kind of give you a preview of the draft budget. It'll be really nice with the cover, binded and everything, but if you want to just kind of pass that around high level, that will be published. Ultimately, will also be on the website. And then we'll get a copy out to the state office, making sure that we have it registered in the state.
And this is our first year publishing a budget book on our own. It used to be incorporated as part of the county's budget book. So thank you so much to the team for putting that together also this year very quickly.
Excellent.
I think Jordan, you helped with that.
Yeah.
Primary trust. Thanks, Jordan.
We used to always.
Jordan's always looking out for us.
She was very happy to help us meet our state mandates.
I'm just letting you know.
Excellent. Okay. Thank you. Thanks, the team. Item number 6, director's report.
We do not have anything specific to lift up this month. But we'll let you know that in January, we'll have a little bit more on a reflection on 2024 accomplishments. I'm looking forward to priorities for 25. It's been a busy year, as you all know, and we do want to thank the board for all of their support this year.
Yeah, thanks to the department for continuing to lead us into a healthier, more equitable community. Any questions about the director's report, anyone? All the business of your favorite side. Item number 7. Crisis.
I'm just kidding.
Okay. One of these days, someone's gonna.
No, nobody wants to put that out there.
Okay, and then we will adjourn. Happy holidays, everyone. Happy New Year.
Yeah.
Same. You got some rest.
2025 is gonna be awesome.
That's
Feel like the
that's it, right?
Thank you.